Check the drug chart and ensure the drug, dose, date and time are correct. Check allergies and cross-sensitivities. Check the medication has an end date and indication prescribed through antimicrobial stewardship. Most medication comes as powder that must be prepared using aseptic non-touch technique, ANTT. Please wash your hands. Clean a blue tray using a Clinell wipe and wait for it to dry. Check the manufacturer's instructions on how to reconstitute the medication. This can be found in the box with the medication. Instructions can also be found in Medusa on Grapevine, and the pharmacists also give guidance on the drug chart. Assemble all the equipment needed for the medication you are going to give. Apply alcohol gel to your hands, wait for it to dry, then apply gloves. Prepare 2 flushes of 10 ml, 0.9% sodium chloride to flush the line pre- and post-administration. Prepare the IV medication to be given, making sure not to touch the key parts and dispose of sharps. Once you have prepared everything, remove gloves and take the tray to the patient's bedside. At the patient's bedside, apply alcohol hand rub and allow to dry, then apply new gloves. Explain to the patient what you're going to do and gain consent. Visually inspect the VAD entry site for any signs of complications using the Visual Inspection of Phlebitis score. The line should always be cleaned with an alcohol wipe using a brisk scrubbing motion for 10 to 15 seconds and allow to dry for 30 seconds before accessing the line. Once cleaned, this becomes another key part that should not be touched. When accessing a CVC, a small flashback should be aspirated into the line. All lines should be flushed before access using 10 ml of saline using a push, pause, flush. Whilst administrating the flush, check for any complications, for example pain, redness, leaking, tissuing, and/or resistance. Once the flush has been administered and there is no problems, the IV medication can be administered. IV medication should be administered as a bolus or infusion as prescribed. When the medication has been given, flush the line again using a push, pause, positive pressure technique. Please make sure to close the clamp. Clean the line with an alcohol wipe using a brisk scrubbing motion. Remove gloves and gel hands by the patient's bedside. Dispose of tray contents and clean with Clinell wipe. Please wash your hands and document administration on the drug chart.